Hi, welcome to Patient Flow. This is our third vlog, and today I thought I might talk to colleagues about the Let's Get You Home policy, which is a choice policy, and how that is intended to help us make sure we achieve timely discharge for our patients from acute services. So a choice policy is a framework that sets out our standards for how we will communicate with patients and carers about the discharge process, what patients and carers can expect when they're in hospital, and how we will work collaboratively with patients and carers to identify the optimum discharge arrangement so that people can leave hospital when they're ready to leave hospital. We haven't got a choice policy at the moment for the Trust, and we are now going to start using a national policy which is branded as Let's Get You Home. This policy sets out some clear communications that enable us to have conversations with patients, carers and our staff, and backs up the conversations that we're having in writing and sets out our local processes and our local standards. So Let's Get You Home really is about ensuring that we have timely discharge, and is one of the tools that will be available to us in order for us to achieve that. Our decision to use Let's Get You Home as a framework to provide a choice policy for colleagues requires all of us to complete a few actions. So one of those will be to provide written information when patients are admitted to hospital, which just briefly tells patients and carers what they should expect from services when they're admitted to hospital, and how we are going to work collaboratively with them to identify an appropriate discharge pathway. That standard letter that goes out to all patients also describes how we work with partner organisations, so whether that's housing or social care or community trust, or indeed with primary care, to formulate the best plan for people once they leave hospital, and to ensure that we can achieve a timely discharge for all patients. So we will be circulating some Let's Get You Home information. We'll circulate copies of information for patients and carers, and some information that's also been written for staff, and we will also provide copies of the policy. I want to reassure colleagues here, we're not looking at lots of additional paperwork to be done. We don't want to make this onerous. All we're looking to do is to introduce a framework which helps us to discuss with patients and carers about the discharge process, to set some realistic expectations, and to make sure that we know the standards that we're working for to achieve a timely discharge. Also, just want to remind colleagues that where patients are unnecessarily delayed in hospital, so whether that's an acute hospital or mental health hospital, that there is an identified loss of function. This is often termed a patient decompensates, and I just want to leave that with people to think about, because actually recovery and people's progress is best done out of hospital.